Hello, good evening. So continue of the sessions. Today we'll see the cybercrime and addictions. So first we'll see what is the addiction. Addiction, if we will commonly see, addiction we cannot say it should be the physical things like drugs, nicotine, alcohol, smoke, anything. But addiction can be occur with the virtual things, that is the gambling, internet, and the social websites. When we are using them harmlessly products such as the substance dependence, drug addiction, and behavior addiction is the gambling addiction. Addiction term is used in the many contexts, but when it clearly defined as the obsession and compulsion for the excessive psychological dependence to reach that level. That include drug addiction, problem gambling, that crime, money, and cyber crimes, the work addiction, when you are working in that aspect, so you ignore your personal and social life, compulsive overeating without the need of the hunger, oniomania, computer addiction, video game addiction, and pornography addictions. These are the patterns and type of cybercrime which involve the person in the addiction. How the addiction has developed. Basically, we can say addiction is a habit. What is habit? Habit is the our choice, like swimming, walking, singing, going here and there, roaming. That is our habit. But some people, however, may experience the damaging the psychological or physical effect when their habit becomes addiction. In the normal layman terms, we can say addiction is the things which is the psychological and physical component when we are unable to control the aspects in the sense of mental or physical conditions. Habit is the choice of the individual. Whenever the person need, he can control them, he can stop them. Cybercrime. Cybercrime is defined as the any unlawful act where a computer or communication devices, other computer network is used to commit or facilitate the commission of crime. In other words, it is a crime that is facilitated by the using the computer in the any form like gaming, internet, surfing, social media, any virtual things. Internet addiction is surveyed and studied by the Dr. Kimberly Young, who is the presented the first research and emergence of the new disorder as the internet addiction. It is the various type: compulsive internet use, pathological internet use, internet overuse, computer addiction. Internet addiction has compared with the many aspects in the substance abuse, like when the recurrent substance use resulting in the failure to follow their work, school, and home life. Similarly, internet addiction is continue with that persistence and recurring social and interpersonal problems that caused by the effect of substance. Internet addictions in the sense of impulsive control disorder that include preoccupation with the gambling, then repetitive unsuccessful effect of control, cutback, and stop gambling. Gambling is a way of escaping from the problems, the significant loss of relationship, job, and education problem, career possibility by the internet addiction if the person is unable to control the impulses. There are various type of internet addiction nowadays we are using as a habit, but we should consider that it's developing in the sense of various internet addiction forms like and converting the cyber crime that include web surfer. When we are surfing the web for social media, Facebook, WhatsApp, Twitter, Snapchat, any other platforms, Then pornography and cybersexual, when the person is getting sexual satisfaction and pleasure by the seeing the pornography and cybersexual activities that involve the person in the online dating, social networking sites, and porn sites, and gaming and video computer and online gamings. What are that factor which enroll the person for the addiction? It is, we can say, internet now is accessible for the 24/7 with the every person. It can be anonymous and private, so person can use it without telling to anyone and without going for the exposure. They feel secure and it's very easy to use. It gives the illusion of connection. It is a very inexpensive and very fun and very engaging. What are the complications of cybercrime? It include there are various physical complications, which is the carpal tunnel syndrome is physical problem, dry eyes, headaches, backache, and eating irregularities, social isolation, and sleep disturbances are the major problem by the internet addictions. Familial problem, if you will see, there are the issue in the marriages because the husband wife is not spending time due to the internet with the together. They are not ventilating their feelings. Dating relationship by the internet, people are engaging in the dating with the known persons, and sometimes that create the problem in the family. Parent child relationship is disturbed because the father or parents is unable to give the as much as playing time with the children to reach that level. Then close friendship has broke due to that familiar problems. Then academic problems, more time in spent searching that actually completing assignments, incomplete or missing assignments, grading became decline. Children are involving so much in the internet. Now the classes are online. So students are involving so much in the internet addiction other than the going for the studies. What are the preventive factors for cybercrime? How we can control them? But the first is you should control yourself and use the internet as a smarter way. First thing we can say, acknowledge your condition or addiction. Acknowledge that your habit is an addiction which requires the constant actions. Realize that you need the support, the sexual abuse and slavery of the women and children with your behavior due to these addictions. Persons or people should limit their access by using of the various firewalls, protections, various websites. Then be accountable to a person you trust. Work at immature and expectation and solution strategies by using the various software. Transparency. Always set up the internet and computer desktop in the open places in your home. So the children and the person, when they are using it, they should not think in the another way and they cannot misuse it. Keep the certain access time when the children and person can access it, and you should always maintain the personal discipline and responsibility. Live without the internet. Say no internet today. Like that, we should make the captions where one day in a week or sometime whenever you need, you should be cut up with the internet and spend the time with your family members. What are the public health challenges and initiative in the problem internet use? A study done in the AIMS that shows there are various public health challenges in the India for the internet addiction, the addictive nature of the internet, lack of standards and uniform decision making, that its measurement and comparability across the studies is very difficult because we are not getting enough data. Then lack of national epidemiological studies that can help to direct the resources based on the need. Lack of awareness among the general public, challenges in restricting access of internet to children and adolescents. The commercial interest of gaming and gambling industries. There are various initiatives in the problematic internet use that is done with that. First, we can say supply the reduction measure, focus on reduction in the availability and accessibility of the internet for children and adolescents should be reduced. Harm reduction measures focus on age appropriateness of the content of gaming and other internet-related material provided to the children, as well as always apply the restriction on the information that can be obtained from children. Then third factor is their demand reduction measure include promote the responsibility using the healthy use of internet, because in this era of globalization there is a need of internet which can internet you use in the very good and effective way, not in the maladaptive pattern. Establishment of treatment center for treatment of patient with the promoted internet use. Internet addiction in Indian perspective, there are various measures has been happened in the various state like internet de-addiction clinic set up in the Tamil Nadu, Chennai, in the medical college hospitals, December 2021. Other we can say the Kozhikode district in Kerala, there is a district legal services society in association with health department has launched a novel project that is called eMochan, a first of its kind clinic for internet addictions. Simultaneously, Ministry of Health and Family Welfare, they had given the electronic health record standards for data security for the privacy. The standards for that data privacy and security standards for basic security and privacy purpose, and information security management that include overall information security and management, privilege management and access control, then audit trails and log trails. So whenever you are using internet in that level, you should understand who had access your internet and why they use it. The data integrity has been done in the data hashing that include 256 higher SHA. Data encryption should be done in SSL version 3.0 as per the EHI standards for India 2016. So it's all about the addiction. Now we can conclude the session that internet addiction is the thing which can take us from the productive way to non-productive way. So whenever we are using internet, we should very clearly understand that what is the use of this internet and in which way we are using it. Thank you. Any questions, please bring on the chats. Thank you.